Welcome to From the Hill. I'm your host, State Representative Jim Arciero, and on today's show, we're going to be talking with Veterans Service Officer Terry Stader, a little bit about his role in Westford's community on serving the veterans throughout the community, returning veterans that are coming back home to Westford, how they can get the resources they need, and for the veterans throughout the conflicts in the United States of America that live here in Westford, and how they can get the resources they need, the help they need. And Terry's done a wonderful job at that, and he's going to talk to us a little bit about that in the show today. Terry, thank you so much for coming on. I really appreciate it.
You're welcome, Jim. Thank you for inviting me.
So you've been the Veteran Service Officer since?
2010 now, so
okay.
A couple years. And it certainly has changed over the course of the years from what I thought it was, but I've enjoyed meeting a lot of our veterans in town. It's been, there's a variety of experiences of what people have been through, and it's great to meet a number of folks that all have one common thing in value, is that they've all been in the service around the world and have done all sorts of jobs. It's interesting, very interesting.
You've lived in Westford for how many years now?
We've been here since 1983, so
okay.
We're still kind of new to the community.
Sure. I remember I met you with a lot of the ham radio activities you've done and a lot of the things you've done over the years, helping out in community events. Westford's 275th, Kiwanis.
Right.
You've been very active in town, and I think it was a few 3 or 4 years ago when you started as the VSO officer in town. You've been a tremendous resource.
Right.
I mean, we've worked together, on a number of issues. I always think that, working with you, you're probably one of the most resourceful VSO officers I've ever met. You're on Facebook, you're on social media. You advertise here on my show a little bit about how you can, provide the help that our veterans need throughout the community. And you've expanded that.
Yeah. Well, I think it's important for people to realize first that there are benefits out there and how they need to get access and promote them, and don't make it look to most people like it's a hurdle. I mean, the issue today is that a lot of people are hesitant about going and seeking services because they don't think they qualify or they weren't in combat. Not every veteran is in combat. In fact, it's a very small portion of our veterans that are actually in day-to-day combat. Even in the various wars and conflicts, there's a lot of people that are behind the scenes that are making that combat veteran more capable. So not everybody's got to be in combat. All you need to do to be eligible for benefits is be in during an active duty period of time. So anything either over 90 days of active duty or over 180 days. And maybe they would have, for some benefits, they may have only had to serve 1 day during a wartime period. So it's not always easy to determine whether you're qualified for benefits. So what we want to try and do is push out as much information. Social media is one way of doing it. Try and get articles in the newspapers, go out and talk to Rotaries, Kiwanis, and various groups. And I did one public session at the library to the networking group there one time. Just getting it out and promoting it and just providing it. Like we have every Thursday morning, I'm at the Cameron Senior Center for walk-in hours where just people can come in and ask questions about what veterans services or what veterans benefits are available to them.
And it's pretty active too. I mean, your office hours are you have a lot of folks with foot traffic coming in.
Well, originally when I started, I was only going to be working 6 to 8 hours a week, and it quickly blossomed over the course of the next several months to be a full-time job, which is what it is now. So I'm still a one-man office, so I'm not always in the office because I do go out to I go to some of our assisted living facilities and meet with veterans. I go to the hospitals, meet with veterans if they're in the hospital, and talk to families. I'll do evening appointments. I like to have appointments where possible, but we don't stop anybody from coming in the door, for walk-in hours.
Certainly.
And I have a really nice office set up so we can have confidential discussions. That's always been part of, another part of the criteria is to determine what are the needs of the veteran. Sometimes they're financial, and not everybody, is open to providing that. So what I want to try and do is that there are means tests for determining some of these benefits, but if you have a situation, they should certainly come and talk to me about it, and we can figure out what is the best avenue, resources.
Now, you've been
like
a
I said.
fantastic partner for Westford. For me, I mean, I sit on, not only the state representative we often have, constituents who are looking for resources, who are looking for some guidance that I can't answer all the time. But I also sit on the Veterans Affairs Committee, and working with you out here in Westford has been, truly a delight, because it's, we're on each other's cell phone all the time, talking about how we can serve the community, how we can help. A whole host of issues. Unfortunately, there's awful situations when there's a killed in action.
Right.
And we've worked together on making sure the family, facilitating the proper ceremony for the family, and working with the VA on the federal level as well as the state level. But you have such a varied job. Very often you have folks that come in and think that you're the VA.
Right.
They think that you're the federal government. Right. And talk to me a little bit about how you guide them the correct way.
Well, I do get a lot of people that call up and say, I was told you're our local VA representative. Well, I am in a sense, but I don't work for the VA. I work for the town of Westford. Here in Massachusetts, as you know, is that it's a state law that every city and town in Massachusetts must have a local veterans agent or veterans service officer. Now, some are full-time and some are part-time, depending upon the population. Any community over 12,000 people is required to have a full-time veterans agent, and it's not allowed to be a collateral duty. In some of the smaller towns, you may find that the veterans agent might be also an animal control, or they might be an agriculture officer, whatever. As
no,
well.
You're not animal control.
But
at all,
I don't
sir.
do any
Okay.
of that.
All
No,
right.
no. Meg and the crew do their own thing, and it's like I said, one-man department, but that's all I do. I can't have any collateral duties. I mean, I have activities like the amateur radio stuff. That's above and beyond the town requirements. But I do. That's what my job is.
But
every
it's
day.
certainly, even like my job, as a state representative, it's our job to listen to people's issues, regardless
Correct.
sometimes of the level.
That's
you want to direct them in the correct way to, Congressman Tsongas or Senator Markey, Senator Warren, etc. But ultimately, you're the first stop. The buck stops with you first, and you from there you try to direct them in the correct way.
I do. I get calls from family members that say their daughters or son of a veteran lives here in Westford, but they may live in Lowell. The parent, the veteran, and I will certainly take questions from them. I don't turn anybody away. The idea is direct them to the most applicable resource that's available to them. The state has its own set of programs as well as the federal programs, which is the Department of Veterans Affairs. And that's the federal side and the state side, and then we provide the support at the local level. So I can be the liaison to all of those programs for them, and my job is to be aware of all the resources and the programs that are out there. So we go to training a lot. We do. There's a group of us veterans agents, veteran service officers that meet every month, and we, I'll say commiserate. We talk about programs and talk about the resources, bring a lot of special guests in that talk about various programs, so we become better, aware of what these programs are. And then, we have our own network of folks, and not everybody gets to service everything. I don't have a homeless population, so to speak. Right. That's the same as what the city of Boston may have, or the city of Lowell. We have our own homeless, scenarios where people will come into town and looking for assistance in getting sheltering requirements, and we've done that before.
And you collaborate with Community Teamwork Inc., right?
Absolutely, yeah. We
had Joe Diamond in last week talking a little bit about home heating and helping folks in need.
Which is interesting is that on that home heating side, although it's been cold, and there was some delay in getting money to some of those folks on the home heating oil side. For a veteran, if they're receiving benefits from us in the state, they get another $500 from the state above and beyond what they're getting from that federal program that CTI administers. So there's ways that we can help people a lot of times.
The Welcome Home legislation and the Valor Act 1 and 2.
Valor Act, correct. Right. Yeah, Valor Act 2, I don't know if it's been finalized yet. I think pieces of it have.
We're having pieces of it now.
Right.
And, just for the folks at home, the Valor Act was a piece of legislation, an omnibus piece of legislation that came through the committee that I sit on, on Veterans Affairs, which specifically deals with enhanced services and access to education and expanded education credits for veterans and veterans returning home. So
Right. So we do, we provide that service, and that's what I encourage folks to do, and what I try and do with the social media and newsletter. I put something in the COA, and also meeting at the senior center every Thursday morning, just to have an open door policy. Let people come in and talk about things. There are no dumb questions.
Right, of course.
We want everybody to ask any question. And sometimes they don't qualify. I mean, sometimes there are no benefits. And it's not because the veteran didn't earn them. It's just maybe an extended family member is looking for something. Like I get a question a question might come off is that my uncle or my grandfather was in the service. Does my son, which would be their grandson, qualify for educational benefits? And they don't. But it's not like they can be passed on. The veteran is who earns it. Surviving spouses of a deceased veteran may be eligible for resources as well. And that's another one we get is that questions about long-term living care, assisted living, and a number of other things. So we have to be aware of the aid and attendance kinds of programs, which is a VA pension, and sometimes that will help somebody manage the long-term care costs that they may have. So
now, on a percentage-wise, you probably don't have the percentages, but you do this day to day, and you do it 24 hours a day, 7 days a week. If someone calls you, regardless of what's going on, you have to act, and you do. My question is, you've been here since 1983. I was born in town and born in 1974. I'm almost 40, folks. Or my wife lets me know that. But 1974. But I went to school with your daughter Emily,
right.
And we've seen the population grow tremendously since that time. I think in the last 15 years, Westford, next to I think the town of Franklin, has grown larger and quicker than any other town in the Commonwealth of Massachusetts. Definitely in our region, but you've seen a large percentage of veterans come looking for services. What would you say of all the conflicts that veterans of the various conflicts, what is the highest percentage of veterans you would see, and which kind of conflicts? Would it be Vietnam? Would it be World War II? Would it be the first Gulf War?
Right.
Et cetera?
Well, the largest percentage today that I'm seeing of new faces, I'll say, we have the World War II and Korean veterans have. A lot of them are already taking advantage of services. They were pretty well into it because they're older, and as they become more medically challenged, they have issues that they probably have already addressed. Now, that doesn't mean I don't see a Korean veteran or a new World War II veteran, but my biggest influx today is in the Vietnam era guys, because they are those that are now from ages of 57 up through about 75. So they are they're running into issues with financial issues because they were part of the big bust in our economic situation here in the United States. There was a lot of folks that were in the 90s and 2000s and when we had our economic disasters, so to speak. And there are a lot of folks that moved from pension days where they actually had retirements to 401ks. And when the stock market went bang, a lot of the 401ks will fail to deliver for them because they just don't have the resources. So there's going to be a lot of folks that are looking at it from the financial angle, not having enough in Social Security or a retirement plan. So we look at it, a lot of them from the medical standpoint. That's another issue, is that the combined health care programs that are out there today are confusing to them, and the VA is a resource for them. So they can provide supplemental health care. So the 57 to 75-year-old Vietnam era veteran is those that are becoming more medically challenged, I like to say. So they're now starting to see, they're aging, obviously, and some of the things that they may have, they may have twisted ankles or broken legs in their younger days, and they were all invincible like we all were when we went in the service. But now they're getting aches and pains. They may not hear as well because they were on the flight line or in an aircraft carrier with the constant noise levels, and they've lost part of their hearing. So we would want to get them in, and we may be able to get a service-connected disability related to the times that they were in those high noise environments. Anything from drill teams and pistol teams, even pistol team members, are constantly firing weapons, and a lot of them just got cotton balls, for hearing protection. And even if they did, they probably didn't wear hearing aids or hearing protection. So they may be eligible for compensation. It doesn't have to be a lot of money. It's not necessarily that people are looking for it, but the big ticket item is hearing aids. And the VA is very good about providing hearing aids for folks that do have hearing issues. And that's a big cost today. Those are several $1,000s per hearing aid. And the VA is very responsive to that. And, you don't have to get a lot in monthly compensation, but if I can pay for $6,000 or the VA can pay for $6,000 worth of hearing aids at no cost. Now, I may get a veteran that come in and say, well, can you help me with hearing aids for my wife? And unfortunately, that she doesn't qualify for it, so to speak. Now, if the wife is the veteran, then obviously she would, where the husband wouldn't. And we do have those that were in both the service, both the husband and wife met while they were in the service, and they both would be eligible, for example. So there's no maximum per household limit.
No, I know that when I've done my office hours, which I do, oftentimes at the senior centers, around my district, I know that I've had constituents that have come in, veterans from World War II, veterans from Vietnam, who can't always get themselves over to the VA hospitals, either in Bedford or in Boston. Now, how does that work? Do you assist with that sometimes?
I do, yeah. We actually, it's interesting that this coming Wednesday, we're doing a VA field trip. So what I've got is, for working with Laura over the Council of Aging over a senior center, is that we're going to take a bus of 10 veterans from Westford that are going to go down and pre-register for health care and get them to their first appointment, for example, to go see a doc, a primary care physician. So I've worked that program out with the VA. We're going to try it for the first time. If it works, then we may do it monthly or quarterly and try and get people enrolled. Now, once they're enrolled and they have an appointment, let's say they have an appointment at Jamaica Plain down at the VA Medical Center in Boston, and they don't want to drive or put up with the traffic or pay for the parking, there is transportation services, not necessarily by our COA folks and the LRTA program that they have over there with their van service, but we can get door-to-door service for them through the DAV, the American Legion. There's a number of various resources that are available for the veteran to get them to their appointment. The VA is conscious of costs here in Boston, and they pay for transportation. So it's not that I can get them a limousine service necessarily, but we can work with them on getting reimbursement. So if somebody else wants to drive them in, we could get them reimbursed so they could at least pay for the gas and parking and stuff like that. So there are programs that are out there, and I do get involved with that. There's a big effort for a program here in the state called Move Vet, I think is what the acronym is, Move Vet. And that's a program where they're coming online to where people can actually go online and schedule transportation to any of the VA medical centers for transportation. And
that was a big issue only, 5 years ago.
Yes.
This is something that I can remember helping constituents out and doing some driving.
Right.
Exactly. It's just one of those things I think that was overlooked when folks were coming home.
It is. So, and we have the resources available to us. We have 3 medical centers that are close by: Manchester, New Hampshire, and here in Westford, we're so convenient to Route 3 just to head north. So that's an actual very convenient facility. Cheaper parking by a long shot than what it is to go to Boston.
Right, of course.
And the VA Medical Center in Bedford is a great resource, and they're adding more and more services there. For a long time, the VA Bedford was just focusing on the geriatric clientele and just specialty treatment, but now they have a hearing clinic going in over there, so they can do hearing tests there, where you used to have to go into Boston for. They're doing a lot of the mental health issues are being addressed there. Bedford is one of the tops in the country in mental health, so they're seeing Alzheimer's and geriatric patients there, and it's a great program. So we try and get them in. That's why we're doing this I'll say the Westford Day at the VA Medical
Yeah.
Center in Bedford is just to get people introduced to what the services are available for them, get them signed up. The VA doesn't know a veteran lives here in town until they register with them.
Okay.
It's not automatic. When you get discharged from the service today, a soldier coming off of active duty is required to go to a stand down and sign up with the VA right then and there as part of their transition to civilian life. But in the older days, days of World War II, Vietnam, and even in the first Gulf War, that wasn't required. And now it is becoming mandatory that they do that. So I don't see the younger guys as much because they're pretty much already in the programs,
Right.
which is a good thing. I'll see them when they run into issues. So they have to, they have issues with the VA or they're not getting this and that and the other thing. Then that's when I will help, because then I'll tap into our federal resources, the senators or Nikki Tsongas or Congresswoman, to help push buttons to get things moving if we need to.
No, I come from a military family myself. My brother and I are both doctors in the Army.
Right.
My brother-in-law is a gastroenterologist, and my brother is a surgical oncologist. They both did various tours in the Green Zone in Iraq. My brother especially, dealt with people at Walter Reed before he went over with amputees, and did a lot of on-the-spot surgery when he was in Iraq. One of the things that I think, years before, we didn't concentrate much, in the military, and didn't concentrate much on the state level, has been PTSDs. Mm-hmm. And have you, possibly it's because of its awareness. Clearly, any conflict that anyone's been part of, there's going to be repercussions, physically and mentally.
Correct.
My question is, are you seeing more of the younger folks that are coming back from Iraq and Afghanistan and in the recent conflicts, dealing with those issues and being more cognizant of them?
I wouldn't say I would see. We already know that the younger folks are getting in, and almost everybody today is being treated for PTSD. Yep. Almost every soldier coming out of the service is being treated for PTSD. PTSD is a possible effect of the trauma of what they've seen.
And a little bit about PTSD, just for the audience at home.
Post-traumatic stress disorder. It's basically, in World War II it was called shell shock.
Right.
In various campaigns and instances it's been called different things. But it basically is the trauma of seeing combat, or seeing somebody wounded, severely wounded, or even worse, being killed within their realm. In other words, somebody that was a shipmate, or somebody in a foxhole with them, to see them actually be killed in action. Those kinds of things are traumatic, and you don't get through them easy. And we have World War II guys that are just now being addressed for PTSD, because they finally realize that that they're still living some of those moments. And they're pretty proud about it, and proud in the fact that they don't want to admit there's any issue, but they have suffered over the years, and it's very important. The VA has some great programs now, and again, I'm pushing it because they've become recognizable, that we can get them and family members seeking treatment and peer group counseling and everything else, because it's not only the service member that comes back with this trauma. Sometimes it's the spouse, sometimes it's a brother and a sister that will also see the change in their soldier, sailor, airman, Marine, and it's important for them to get brought into this whole package. So it's not just the veteran that's getting treated these days. It's sometimes in whole family situations. So
now we're starting to wind down on the show. My goodness, we could talk for a lot longer. I mean, there's so much to cover. What do you see as your greatest challenge moving forward?
Well, the biggest challenge is to try and identify the veterans. They don't have to. I have a pretty good idea with the census who is a veteran, okay? But I don't call through every household and ask if they're a veteran. So the biggest issue is that if people have questions, they reach out. I'm there. It's a free resource. Find out if you qualify. Every veteran qualifies for benefits, and can they use them? Maybe. Let's find out. Don't just let it let it slide and say, don't worry about it, I don't need it today. Well, I'd much rather be taking an application with them walking in the door than to go to Emerson Hospital and take it from the bedside when they're ill.
Sure.
So the biggest thing to me is, and think of not just yourself, think of your family as well. Sometimes it's important that they come in for and look at the options of what's available to them. And even if it's a no, they'll know, at least have an understanding of something and of what the benefits are. And there's probably some way of tapping into some resource for the veteran. They may not need it today, is what I meant, not by no saying they'll never qualified, is they may not need services today, but in the long run, down the road, as they age and the financial situation changes, they may be eligible.
Now, you've done a wonderful job at outreach, Terry. I always say that. You're one of the most accessible VSOs I know, and we meet and see so many of them. I'm blessed, in my district with wonderful VSOs that do such a great job. But you're out there constantly at events. You're accessible. You run wonderful programs to get folks the benefits that they deserve and they need. And you're on social media, and you're also available through email. Mm-hmm. Would you say that email is probably the most, or is it walk-ins you think is the most?
Well, I get a lot of people email me, but not everybody has computers. So the phone, people leave messages at all times of the day and night. Fortunately or unfortunately, the voicemail comes direct to my cell phone. So I'm pretty responsive, any time of the night. I know I've been corresponding with people in email 11, 12 o'clock at night and at 5 o'clock in the morning. So it is what it is. It's the nature of today's world is you don't want anybody to be left out there hanging. And I think it's important to get back to people as soon as you can because, nobody likes to leave a message and not have it be responded to.
I know that very well. Well, Terry, I want to thank you so much for coming on. Your information is going to be provided by the Westford Cat Studio on the screen in order for veterans or family members, family members of veterans, to get in touch with you on anything that they are looking to find information about or any sort of resource they're trying to track down to get the benefits they deserve. Thank you so much for coming on. I certainly appreciate it.
Thank you very much.
And as May approaches, we're going to be having our legislative luncheon again with the other VSOs from my district in Chelmsford and Littleton in May. We have the date, but it's going to be coming soon. We had to cancel because of the snow. But thank you again, Terry, for coming on. I appreciate you for tuning in on my show today. My office hours, as always, will be posted in the Westford Eagle, the Littleton Independent, the Chelmsford Independent, the Westford and Chelmsford Patch, and the Lowell Sun. Thank you so much for tuning in, and I look forward to seeing you next time.